Hello, and welcome to the Every Ancillary Sales Podcast. I'm your host, Michael Berg, joined as always by Viv Hudson. Viv, we got another great podcast guest on today. I'll let you
Yes,
do
we
the
do.
honors.
Yes, we do. So we've got Franklin Moses here, and Franklin is from an exciting new service around transcription. So, transcription services for physicians, and he's got a couple of different programs that he's going to tell us about today. So, welcome to the podcast, Franklin.
Wonderful. I'm happy to be here.
So, Franklin, I'll be honest, I think most people who work in our side of the industry probably don't know a lot about transcription. So, could you maybe level set for us and just tell us what are doctors doing right now that don't use a virtual transcription company like yours? What is their current method for transcribing their medical notes?
Well, I think right now the biggest problem that providers are running into is definitely the documentation burden. Seeing a lot of patients every day requires a lot of time that they're spending in the EMR themselves and spending less time with the patient and quite honestly less personal time after hours when everything is done. Between the medical transcription and the virtual medical scribe that we have, those are two products that we have that are designed to relieve that burden amongst the providers, give them back some of their free time and see more patients and spend more time dealing with the patient directly.
Okay. So Franklin, what is with your virtual transcription service? Could you explain exactly how that works and how that would translate into saving them time and seeing more patients?
Yeah, so our virtual medical scribe is actually the latest kind of product that we have here right now. So the virtual medical scribe is actually connecting the provider with a telecommunications product that they're installing on their tablet or their portable laptop, and it connects them directly to the provider and allows them to listen into the conversations that they're having with the patient. And they're actually filling in the chart in the background, like as if they actually had a scribe in the office with them. There's a lot of benefits to this because the scribe is available anytime, any place. We also have a handy app that can be installed on the phone, and they can text the scribe to look for information and send them information about any patients if they're not in front of their computer or away outside the office. And the second part of our product that we also have is the medical transcription, and it's a little bit more traditional, in which after the provider's done seeing the patient, they just kind of dictate into a 1-800 number or into the app that's on their phone, and our staff will just transcribe that information and send it back to them either as a Word document, or we can go ahead and enter that also into their electronic medical records file as well.
It sounds like such a great idea. Like, I know one of the banes of being in healthcare is probably all the paperwork and documentation. So, how receptive are physicians to this program? And I guess the other side is how receptive are patients, because patients are obviously having a conversation with their doctor and then knowing that a third party's listening. So, what does that look like?
Well, that's a good question. HIPAA compliance and making sure that everything is secure. So, from the patient perspective, actually, the only difference is typically these days, some providers have scribes that are actually in the office, kind of typing while the provider is having the conversation with the patient. The only difference is ours is in a remote location, and as long as they tell the patient that there is a virtual scribe and they're taking these notes, then that covers compliance. Our software is military grade encryption. We follow HIPAA guidelines in everything we're doing. But also that in terms of the patients love it because they actually get to have a conversation with the provider now. The provider is not stuck to the screen and typing their notes and just really more concerned about clicking all the different boxes that they have to these days. And they're actually paying attention. And from a patient's perspective, that's quality service. That's what the patient is looking for. That's what they came to see the doctor for, and it actually improves the overall patient experience in the office. Providers love it just because they can actually do what they're supposed to be doing, which is interacting with the patient. They can do better examinations. They're getting a better quality note because they can actually be free and more in their conversation with the patient. And they're actually having a conversation with the patient. So that personal experience that providers used to have, we can bring that back using these products and this technology.
It's a pretty simple but slick technology. I took a look at it. It makes a lot of sense. I think it would make sense to providers, but of course, doctors are always squeezed for time, they're squeezed for money, And this has to make sense in terms of the net benefit to the practice, to the bottom line. Do you have any empirical evidence to show what the net benefit of using a virtual scribe would be?
Well, there's a variety of benefits. Patient quality actually is an important factor with the insurance companies these days in terms of their bonus and their incentives as well. So even in terms of patient quality and satisfaction, this goes toward that to apply for those. The other thing is that because providers aren't spending so much time in front of the computer after every patient kind of filling out the note, they can actually see 2 to 4 more patients per day because they're spending less time in front of the computer. And on top of that, they're actually spending less time after hours that they normally would be doing catching up on patients. Normally, a provider that might see 25 patients per day can spend a good hour and a half to 2 hours after the end of their shift just even catching up on their notes. This way, you can actually see 2 to 4 more patients per day and not actually spend more time even after work catching up on your notes. So there's the benefit of seeing more patients, which actually pays this for itself in the service, and then the quality of life for the provider as well.
Because they can get home earlier for dinner, right?
Yeah, and I'm sure the family would appreciate that.
Yeah, and I even wonder, like, I'm kind of thinking, like, if I had to sit down and write out some notes after talking with a patient for 10 or 15 minutes, I'm going to forget perhaps a couple of points that were spoken about. So I'm imagining, like with the Scribe, that perhaps the notes are even more complete and more accurate as a result of that.
Exactly. And 30%, the CMS has identified that 30% of notes that are created these days are carryovers from the previous note, which is basically saying that they're templated. When you use a Scribe or you're using transcription, you're actually getting a more unique note per visit because the provider doesn't have to worry about all the stuff that they have to type. That's actually left up to the Scribe or the transcriptions to do it. So it actually becomes more compliant with CMS and Medicare and basically any other insurance company to avoid that kind of templating repetition that occurs.
Do you find that there are certain specialties that have more of a need for this than others?
Yes, there's different specialties and different. Both products kind of serve each specialty a little bit different. For psychiatry and therapy fields, transcription is usually a better solution for them. Typically, it's more of a recording and a narrative, which works better. They don't necessarily need a live scribe for that. Family practice, obstetrics, gyne, surgical. Virtual medical scribe is actually pretty good for them, as well as providers that might see geriatric patients in skilled nursing facilities, as well as providers that are more mobile, seeing patients at homes or in the hospital, such as hospitalists. The virtual scribe is a really good solution because it's almost like a virtual assistant that they would have available to them all the time. And they don't have to, quite honestly, pay as much as they would if they paid an employee. They don't have to worry about the overhead cost of insurance and travel and all that other stuff that would be there.
So you're in front of a doctor, you're the medical sales rep. How do you open up this conversation with a physician? In just a short sales pitch, where you go for a 30 to 60 seconds, let's get their attention with what do you say?
I would probably ask them what their biggest pain point is in terms of documentation and how much time they spend. And that's a pain point, I think, for every provider that is out there that has it. And I think the important thing is how much time that they would actually save by using a product like this. And also the number of patients that they could increase, and basically the product is paying for themselves. Everybody says time is money. How much time could a provider get back from utilizing our service, at the end of the week? If they, on average, spend an hour and a half a week a day, they're basically getting about 7 or 8 hours back at the end of the week. And most providers are probably, I would say, at least in the $200 to $300 range on that. So if you just do the math on that, just the amount that they save in time after hours or even during the day in documentation just literally just pays for itself.
So Viv, how do people get started with medical transcription?
Absolutely, Mike. So you just go to everyancillary.com, look up medical transcription in our list of services and add that to your bag. And away you go, and you'll get all the information that you need to get your doctors signed up, get yourself signed up, and speak to doctors about how you can get them home for dinner much earlier. So thanks a lot for that, Franklin. I think it's a great service.
Thank you very much, Michael and Vivian. I appreciate it.